So this is basically the third step in the patient's journey through their treatment course. So once they've seen the doctor, they've consented to radiation treatment, and they'll go to have their simulation session, which you've just seen, and then they'll come in here, which is the treatment planning. So every department has a treatment planning room, and in essence does exactly the same thing. So once the patient's had their CT scan, we import it to our treatment planning system, and it's very important that the patient has a separate planning CT scan. One, because we need them in their treatment position, so that the plan we calculate is going to be representative of what they're receiving on the machine in the same position. And two, is getting a little bit physicsy, but the specific housing field units or the density assigned to the certain structures is dependent on each individual CT scanner. So that one CT scanner's information will be in our treatment planning system, so that's why they need to have their own CT scan. So basically, once we've imported the CT scan, there might be a step where the doctor has asked for us to fuse an image, so we might need to import an MRI for better soft tissue delineation, specifically for the brain and prostates as well, as where we would import them. We might import a PET scan, obviously very sensitive to picking up those little nodes that might not be visible in MRI or CT. So that's up to the doctor, and they'll request that for when they book the patient in. So this gentleman here is a prostate case. So there's basically two steps to getting the plan ready. The first step is marking on the area that we want to treat, and the second step is marking on the area that we don't want to treat. So for this man, he has prostate cancer. So in this case, the doctor's marked on the prostate and the proximal seminal vesicles for treatment as well. So that's what we're aiming to treat to a very high dose. This man also had an increased risk of spread to the lymph nodes in the pelvis as well. So the next area that the doctor's marked on is the CTV. So that's the clinical target volume. So that accounts for any microscopic or macroscopic spread from the primary tumour. So because he's at an increased risk of spread to the nodes, we're going to, the doctor here has outlined the nodes, and that's an area that we want to treat as well. But because there isn't any disease there yet, it doesn't have to go to quite as high a dose, so we can limit the dose to that, but really drive the dose into his prostate. For all our prostates, as Peter spoke about a little bit earlier, we use a technology called VMAT. So that's that intensity modulation as the treatment machine rotates around the patient. So we will tell the machine, these are the fields that I want you to use. So in this case, we've used 2 full rotational arcs. So the arc will start behind the patient and rotate all the way around, and then when it gets to the bottom here again, it'll go back the other way. And in the background of the system, we've told it while it's rotating where to give the dose and not where to give the dose.